My question's about urinary tract infections. Keep having reoccurring urinary tract infections, and I do have a hard time emptying my bladder. What's the best? How do you totally get rid of the urinary tract infection?
Boy, if I could totally get rid of urinary tract infections in older women.
You would make 90% of those women so happy.
They'd be happy and I'd be famous.
Oh, yes.
Instead of poor and obscure.
Oh.
There's a lot of reasons older women get urinary tract infection. You guys start off with a bladder that is attached to the front of the uterus. And you have a very short urethra. The opening from the bladder to the outside is only about 1 centimeter long. So you have a very short half-inch little tube there to drain your urine. Childbearing plays hobs with the entire reproductive tract. When that uterus grows from a little tiny thing, about 1/3 or 1/4 the size of my big fist, to something big enough to hold an 8 or 9 pound baby, it has to grow enormously. It stretches all the tissues around it, including the bladder. Everything gets pulled out of place. And then after you deliver the baby, nothing goes back to where it exactly was. Everything now has been stretched out and sags and starts falling down by gravity. And so the bladder is no longer back where it was as a kid. It's kind of hanging down there, falling into the vagina, and you get little kinks in that short urethra so that the bladder doesn't want to empty fully. Besides which, the muscles have all been stretched out, the pelvic muscles are all weak, and so that bladder has trouble emptying completely. And getting it so that it empties completely is important if you want to avoid infections, because if you get a little bit of bacteria in there, it sits in that stagnant urine and grows, and you never really totally flush it out.
Yeah.
And so there are some surgeries that you can do to pull the bladder back up into a more anatomical space, but that is a significant surgery, and most people don't want to have surgeries they don't have to have. And so they put up with what they've got after a childbearing. To further complicate things, the bladder or the urethra opens up right at the top of the opening to the vagina. We call it the introitus. And that introitus is only a few centimeters anterior to the rectum. And so you've got poop that's coming out there a little bit behind the vagina, and it is so easy to contaminate the vagina and hence the opening to the bladder with stool. And so E. coli are the most common infections because they're basically contaminants from the rectum. It's actually now getting bacteria growing into the bladder. And the longest lasting solution is indeed a surgical repair to pull the bladder back up into a more anatomic position.
If it is prolapsed.
If it's prolapsing or even relaxing. It doesn't have to be totally prolapsed. Prolapse means it's actually come out through the vagina. That's a no-no.
Well, there are grades of prolapse. Yeah, you don't want it all the way down. Grade 4 or whatever.
But short of surgery, our biggest goal then becomes trying to strengthen the muscles. Mm-hmm. And so the pelvic girdle muscles need to be exercised. And once more, this is a family show, so let me make this description as discreet as I reasonably can. There's actually machines you can use for this, a little probe that you can put in the vagina. It will tell you how much pressure you're putting, and you try to tighten all those pelvic muscles, and the probe will give you a numerical response.
And there are physical therapists that will train you to do that pelvic floor tightening.
Yes, and they're called Kegel's exercises, and they work reasonably well. Mm-hmm. So first, work on the muscles themselves. Secondarily, we have to try to clean up that pelvic floor. Mm-hmm. I've already described how mechanically you've got the the opening from the bladder right at the top of the vagina. The vagina itself is moist and mucus producing. And then right behind that, you've got the rectum. And so you've got lots of bacteria coming from the bowel, and it gets contaminated forward. What you want to do is you go to the drugstore, you buy a Providine iodine solution. It comes in a pint or a quart bottle, depending on the size that your store carries. And you add that to nice warm water, about 1 part iodine to 4 parts water. And now you've got a solution that's really good at killing bacteria. And you use that as a wash on your entire perineum. You start all the way forward and you wash backwards. And you take a cloth and first you squirt the iodine solution and then you rub backwards front to back. And you're moving everything away and you're killing as many bacteria as you can. And you do that a couple of times a day. You do that in the morning, you do it in the evening, so that you don't get too much bacterial overgrowth. And it helps if you can do it after you have a bowel movement. Anytime you produce stool, you are contaminating that whole area. And so now you want to use the iodine wash to clean things off.
Yeah, and then it'll make a stain.
It does stain.
Because it has a yellow color.
Yep, well.
Mustard.
Yeah, mustard brownish.
Mustard brown, yeah.
Yeah.
And then, Jerry, what about D-mannose, cranberry juice, hydration, D-mannose?
Well, D-mannose is a sugar you can buy online.
Yeah.
It's a sugar that we humans cannot metabolize. So when you take your D-mannose orally, it'll hit your bloodstream. Your body says, what the hell am I going to do with this? And dumps it out in your urine. And so your kidneys excrete it. And in the urine, these bacteria that tend to infect you have these little, we call them cilia. They're little hair-like structures that let them adhere and attach to the bladder wall. And the D-mannose, being sugar, gums up their little cilia so they can't attach to the bladder wall. So now when you pee, you wash them out more efficiently. Yeah. Which is really kind of nice. Doesn't kill them, but it just makes them slippery. They get on this little slippery slide and they zip right out of you.
And
which is kind of nice.
Yeah.
Yes. It's one of the
and
times
then
you do want to be left.
hydration, drink plenty of water, cranberry juice.
Yep.
And then for the antibiotic, when I do get the urinary tract infection, which is the best antibiotic?
Now that depends on which bug is infecting you at the time. And for that, you go to the doctor, you tell him, doctor, would you please culture this urine?
Yeah, but they do that, but there is another one that they give over the counter, or actually I think it's a prescription. It's called methenamine hippurate.
Yep.
And they do write for that, and that can be used for short periods of time as well. It's not as potent as some of the other antibiotics. But then if you're having recurrent infections and it's troubling you, then the best thing is what Dr. Mixon just mentioned. You go have a urinary culture done, then they have sensitivities, and then they give you the exact antibiotic that you are sensitive to.
Right. But if you can cure this without an antibiotic, that's always preferable, because the antibiotic is going to start killing the good bugs in your gut too.
Yeah.
And we want those.